Hi, folks. Today is Monday, September 21st, and a few updates for you today. As we mentioned last week, we did have a staff member from our healthcare center at the Woods campus of RiverWoods Exeter test positive, which set us off to doing a bunch of testing. We, at this point, have tested our healthcare staff, and while we don't have all of the results back yet, we have no additional positive tests, so that's good. We've tested 102, so all of our healthcare residents at RiverWoods Exeter across the 3 campuses. And we did have one resident from our Ridge campus assisted living test positive. That campus will get retested by the state tomorrow. The Woods Campus Healthcare Center was retested by the state today. So we will, I think I've said this before, we'll stop at nothing to try to stay ahead of the virus, and testing and retesting. Better, knowing is better than not knowing. We will just try to keep knowing and staying a step ahead. The good news is it does feel like this will be a more contained issue. It's still an issue, and it's a reminder for us that we're not out of the woods yet. The virus is still out there. In fact, the case counts in New Hampshire and in our counties are growing. That's not unexpected because the number of tests we're doing every day has gone up pretty significantly from, about 1,500 or 2,000 or 2,500 in the early part of the summer to now we're testing more than 3,500 people a day across the state. So you would expect with a constant positivity rate that our number of cases would increase, but they're going up a bit more. So we're paying attention. It gives us pause, and it kind of leads us to pause as we think about what that might mean in terms of opening up our campuses to additional services. So we'll be back with you more on that in the next few weeks. But I will say this, I implore you, don't go to a restaurant. And if you're a family member and you don't want to have dinner with your mom or dad, cook for them. Or get takeout if you're a bad cook, but don't go to a restaurant right now. And if you own a restaurant, I'm sorry, but it's not a place for our folks to be right now. I'll tell you, I haven't been to a restaurant since March, and I wouldn't go to one until I know our country and at least our state is in a way better place. So we're not there yet. But things are not all bad. And I read an article this weekend that one of our residents sent to me. And I found it to be super interesting. It made a bunch of points, but five points, sort of how are we going to survive the winter? And I want to talk pretty quickly about a few of them. The first one, it says, is accept reality. And here's reality. And I love that because one of my favorite business leaders wrote a book, and one of the lines he said is, the first job of a leader is to define reality. So if I could define reality for you, I would say this. We are in a better place than we were in April, but we're not there yet. And we are just going to have to accept, whether we like it or not, that we're going to live alongside this virus for a while until, probably until early next summer, when everyone has had the opportunity to be vaccinated. And so we're going to have to live alongside it for a while, but the challenges that go with it will decline as other good things happen, and other good things are happening. In April, we didn't have access to PPE. And so when outbreaks occurred in nursing homes around our state, people were way more at risk. Now we have proper PPE. In April, we didn't have testing. Now, when we had a positive test pop up, we were able to call in testing and get that done over the course of several days. Now, the results are still a little slower than we'd like, but we have a plan for that too, to get those on a much faster basis. So reality is there's no silver bullet. We have to make a bunch of smart decisions, most of which we don't really enjoy. Generally, my thought process is, if nobody's going to like this decision, it's probably a smart one because it's around risk mitigation. So accept reality. The article also talks about plan for more shutdowns, right? And not, for us, that's not necessarily, closing the world, but they talk about it in terms of, think of it as a jagged line of progress. Things aren't getting better in a straight line. They're getting better in fits and starts, and we have to keep adjusting and paying attention. So think of it like a jagged line. It talks about live like you're contagious, which is my favorite, and I actually use that on my kids. Live like you're contagious. So don't be around groups of people you don't know. Don't be around groups of people at all, because frankly, you might be, if you're contagious, you're going to infect them. Wear your mask. It's really not that hard. Just, here you go. Over your mouth and your nose. Not that hard. It's not sandpaper, it's just a lovely cotton. Wear your mask. Wash your hands. So, keep 6 feet apart from people when you can, and keep your interactions shorter. So if you do find yourself in a situation where you're around a larger group of people, don't be there very long. If you run the risk of getting exposed, just be exposed less. And then it also talks about hunt the virus, which I absolutely love, because that's what we want to do, and that's where testing comes in. And we have more tools now. We have more access to testing. We're getting access to faster testing. And in addition, with antigen test machines coming and this new test called BIAX now that Abbott has put out, which is just a card, all of those things will allow us faster and cheaper ways to test in a like 15-minute turnaround. And the nice part about the cheaper is that then you can do it more often, and we can test our staff more often once we have access to those tests. So that might be November or early December, but that's kind of what I mean by the jagged line of progress. The more we know, the better decisions we can make. And until we know, what we ask you to do, wear your mask, stay away from people you don't know, stay away from large groups anyway. Don't go to a restaurant, because you can't eat and wear a mask. It's just one of those things. I've tried to drink my tea a few times with my mask on, and it doesn't work. We're going to have to reconsider holiday traditions this year. Things are going to look different. Thanksgiving and Hanukkah and Christmas. And that's unfortunate, but it's also safer. So we're going to think through all of those things. We're going to try to make good decisions for you, for your neighbors, for our staff, for their families. And we're going to get there. We are. So until then, wash your hands, wear your mask, keep your distance, and stay healthy, my friends.